Hello, this lecture is on dynamic sonography. What is dynamic sonography? This is a 40-year-old woman complaining of fullness of abdomen, and this is a sagittal scan of lower abdomen. It looks normal, but if you observe quietly for some time, you see that there is a rotatory movement here, indicating that there is a confirms a large mass which moves in a rotatory fashion with respiration. So that is dynamic sonography. So dynamism in the patient, which is picked up just by observing for a few seconds with the probe being kept stationary, or it can be dynamism of the performer. You can do some maneuver with the probe, or dynamism of the patient. You can ask the patient to do something and pick some sign. So these are all covered in this lecture, which is unconventional, called dynamic sonography. If you would like to listen to this lecture, you will log on to sonoshare.in and listen to the lecture on dynamic sonography. Thank you.